10 years before.
Dr. Sutton, I'm going to give that to you.
Yeah, typically the recommendations for BRCA specifically would start screening at age 25 regardless if there's a known mutation. And as Shara said, if it's younger than 25, the only time we typically would recommend specific management would be if it's 10 years younger. So if the youngest person in the family with breast cancer was at 33, we might begin screening at age 23, younger than age 25. So testing is not performed on children, so an individual would need to be at least 18 years of age, and then you can understand that if the interventions that are going to be recommended are not going to begin for a few years, depending on your knowledge of that individual and their level of maturity and the other kinds of life factors and decisions that are going on for young people in their early 20s, those might be the kind of considerations about whether you would approach this with someone under 25.
I do want to add that while there might not be specific interventions until a later age, like Dr. Sutphin had said, it's important to encourage women, or teens actually, just to be aware of their ovarian and breast health and spark that proactive disposition to have discussions with their doctors about it and be aware of it. And it's really up to the mother to what she feels, or father, if they feel their child is ready to accept the idea of risk, but many parents might choose to introduce it at a young age so that the kids can grow up with it not being scary, but just something that they accept as a normal part of life.
And I'm just going to ask one more question, and then I'll close and give you guys who are all on the call some instructions and some ways to access this afterwards. There's a question about, does the BRCA mutation live with me or my tumor? What should be tested?